Welcome back. Welcome back to Sunrise. The Jamaica Statistical Society recently held a mini symposium under the theme, Shaping Jamaica's Road Safety Policies Using Statistics. This morning I'm joined by Dr. Novi Younger-Coleman, the chair of the mini symposium planning committee and past president of the Jamaica Statistical Society, along with Inspector Robin Williams, a symposium participant, and Dr. Eric Williamson, a panelist at the symposium and member of the Jamaica Statistical Society. Good morning, gentlemen and ladies.
Good morning.
Very happy to have you this morning. I want to start with you, Dr. Younger-Coleman. We were talking about a policy using statistics to guide policy development for road safety. Why do we need a policy for road safety?
Well, we certainly need guidelines to determine how we can expect persons to operate on the roads. And so there are different laws that have been put in place.
Right.
And we're thinking that definitely if these laws and guidelines are to be put in place, they should be guided by data that exists. And that was the reason we did our mini symposium, to find out what is out there, what exists, what data do we have, what is being done. And before that, some work is being done, but there's more to be done.
More to be done. Well, Dr. Williams, I ask you, how can statistics and the statistics that you would have been able to gather, how can it influence the policy? How can it help us to have safer roads?
Well, first of all, let's talk about data collection from a hospital setting where I work. Data on road traffic accidents is collected from several sources. The hospital itself uses a ICD, International Classification of Diseases, where it is code related, and a code would have been assigned to road traffic, and therefore one can access this information. Secondly, at the university, we also have a trauma registry that was set up by Professor McDonald, and this includes all trauma patients that are admitted, where the demographics are studied, the mechanism of injury, injury severity, and treatment. And there are several other research work done at the university, so the information is there.
So what you're saying, Doctor, is that the University of the West Indies captures by coding into a system particular types of events that come to their emergency room, and when it is a road injury, when it's an injury, on our roads, that case is coded as in a particular way. So we'll have a log for a period of particular types of trauma. And then you're saying there's a trauma registry. So there are already existing two methods of data collection at our university hospital and other hospitals in the country.
Other hospitals as well.
Has now that information been going now to policymakers?
Well, not exactly presently, but that's one of our goals. The JSS, along with all stakeholders, physicians and non-physicians, statisticians, research groups, cross-faculty research, and governmental agencies are in the process of looking at road traffic accidents and injury prevention. And at present, we are launching evidence-based research on motorcyclists, fatalities on the road, and this will be useful information that can craft on important policies.
No, I bring in Inspector Williams, because we're talking about road safety, because as at November 8th, and I'm sure following that date, at November 8th, our road traffic fatalities was about 300. And since then, from November 8th to now, I'm sure there are many persons sitting in their living room saying, I know this person last week, those two persons the week before. We're almost at the end of the month, and that number has climbed. We've had some memorable, unfortunate incidents. Coming to my mind immediately is those two school children in Montego Bay were on their way to school. How important is information for so the Public Safety and Traffic Enforcement branch on the road here in Kingston, and just the police officers across Jamaica, how important is the information for you?
Information in that regard is crucial. In fact, As of yesterday, deaths on the road, we are at 327, arising from 288 collisions. And when you compare that with, for the same period last year, it was 291. So we are up by 36. It's a tragedy. I keep saying it. We have a behavioral problem, and it is persistent. Education is really the best way to approach it. But of course, as an arm of government with enforcement, that cannot be ignored. So we too will continue to be persistent.
You'll continue to be persistent. Just before I come back to the past president, we have these incidents, and you've said that we have an increase year on year where we're not doing as well as we would have wanted to coming to the end of the year. What enforcement is important? What can our motorists do differently? And this seems like such an obvious question, but I want you to say it. What can our motorists do differently to reduce the incidents of whether collisions or fatalities?
Simple. All motorists need to be considerate. Self-preservation. If you love your neighbor as you love yourself, naturally you're going to behave accordingly. The excessive speeding, the lane violations, you name it, it's happening out there. Is it that we're just inconsiderate, or we simply just don't know how to drive?
Or we think we can move fast enough. We know it's kind of wrong, but we can just slip through quick.
And that is unfortunate. We just need to be considerate.
And realize that our inconsideration may be fatal to us or the other
users of the road.
Wow. Back to you, Dr. Younger Coleman. Out of the Statistical Society, how else can we gather information? Your society is concerned about providing data to policymakers outside of the hospital, which is very important. Are there any other methods that data can come into the relevant parties to inform?
Yes, one of the beauties about this symposium is certainly made us aware of the many sources of data that we could use to try to investigate. So, for example, the Mona Geoinformatics Institute does provide data. For example, they have information on the crash hotspots, the road, the features of the road where accidents do happen. They have that data. The National Works Agency does gather traffic systems data. Then there, of course, from our road safety unit, Mr. Hare made us aware that the black box, especially in the newer vehicles, gathers even more information. I mean, so there's a whole minefield of data that we could begin to examine.
So we can now have safe vehicles for Jamaican roads based on black box
and
data.
Training in defensive driving, because it's the black box we were made to understand gives information on the angle at which the driver was holding the steering at different points in the accident.
The speed before
impact and all of that. So there's that information, not to mention the NCDA was with us, and there's a drug use data that we need to tap into. The Health Ministry, in addition to the Emergency Division, gathers data, on accidents that come in, injuries that come into the hospitals on, driver disposition, whether or not they're using alcohol, type of vehicle being used. So if we begin to examine what happens where, well, we'll have to put in the epidemiologists, and I believe there's some room for qualitative research. Because information is there, education is there, but it doesn't seem to change behavior. What are the barriers and the facilitators? Well,
let's talk about barriers and facilitators. Yes. Is there any room for the civilian, for the users of the road to provide data? Is there any space that they can say or, call, I saw this, or I think this is important. Can we be involved?
Yes, civilians can be involved, but I believe it would need, of course, somebody would need to take up the mantle to say, okay, here's where you can call with information. But one of the things pointed out in our symposium is that there are the CCTV networks that are being set up across the country, I suppose, that in Kingston. Maybe even a study could be done to observe what's happening there, observe civilian behavior at the different points, and that could also give us some information that will help guide what do we do.
We have on screen here some of the hotspots, the areas across our island where we would have been seeing high numbers of collisions and fatalities. And we're seeing there that the corporate area, Kingston and St. Andrew, is almost obliterated. in dots, and then along our coastlines. And I would not like to think that that is the north-south highway stretching across the top of the island and then over into the parishes of St. James and Westmoreland. So basically, if you know the road network of Jamaica, you're seeing that those are our major roads. You're seeing as well the highway from Caymanas and into Clarendon as well. You can just follow along that and see that we're having these accidents along these major thoroughfares. Doctor, how can the policymakers, the government, the police, how can they better access the information that I understand our hospitals already have? Is there an existing channel? Is there a channel being developed that you know of? How can we get more info?
A channel can be developed because this is very necessary. And in particular, from my perspective, we need to look more closely at injury prevention.
Okay.
So the data is there, as you just showed us a map, and some of the hotspots are in Westmoreland and St. Elizabeth. I think that for us to employ injury prevention, we need to look at these areas, look at the road surfaces, look at the traffic lights if they are working, educate and examine the culture. Now, culture has a very big impact on for motorcyclists, for example. So we have the data in terms of the severity of the problem. Several studies have done that. We have identified the etiologies, so we need to make an impact.
Etiologies, what do you mean, sir?
The causes.
Okay.
Causes.
Okay, so you're saying prevent injuries, try to prevent these accidents in the first place by repairing the roads, making sure that our signs or traffic signals work.
Certainly,
first to begin
certainly.
with. Now, Inspector, we are going to go into further discussion on the show this morning about the legislation to come concerning the Road Traffic Act, 80-year-old Act being given some attention. What is your vision? What do you think this could accomplish? Considering the things that have come out that are in the Act in terms of fines.
I've said it before, this Act will be a game changer. It's radical. There are aspects of it which is outside the box, and that is something that we need. It's a way of curbing behavior, giving the law some teeth.
Oh, yes.
Our citizens need to understand that we are about saving lives, all of us. We are all stakeholders, and as such, we cannot flounder.
I'm on a few words, but very important words, and we're going to be continuing the conversation later on in the show about the Act itself, the revisions, the parts of the Act that we've heard about in the public media, and its implications for better safety on our roads. I want to thank Inspector Williams, Dr. Eric Williams, and Dr. Younger Coleman for joining me this morning at Sunrise. We have more information and more fun and excitement here on Sunrise. We're on a break. Why don't you stay with us? We'll be right back.